Welcome to today's medical exploration. We're diving into a condition affecting the male reproductive system, cryptorchidism, also known as undescended testicles. Join us as we unravel its causes, effects, and potential solutions. What exactly causes cryptorchidism? The etiology is often multifactorial. It can stem from hormonal imbalances during fetal development, particularly insufficient androgen production. Physical factors also play a role, such as a narrow inguinal canal, which obstructs the test descent. Prematurity and low birth weight significantly increase the risk. Genetic predispositions and even environmental factors are being investigated as potential contributors to this condition. Now let's understand the pathophysiology. Normally, the testicles develop in the abdomen and gradually descend into the scrotum during the later stages of gestation. In cryptorchidism, this descent halts prematurely. This abnormal location exposes the undescended testicle to higher body temperatures compared to the scrotum. Prolonged exposure to these elevated temperatures can impair sperm production and increase the risk of testicular cancer later in life. The lack of proper hormonal signals and physical obstructions further contribute to this disrupted process. Epidemiologically, cryptorchidism affects a significant percentage of male infants. It's estimated that around 3% to 4% of full-term male infants are born with undescended testicles. The incidence is considerably higher in premature infants, reaching up to 30%. While many cases resolve spontaneously within the first few months of life, a portion requires intervention. The condition is generally unilateral, affecting only one testicle, but bilateral cases do occur. What are the telltale signs and symptoms? The primary and often only noticeable sign is the absence of one or both testicles in the scrotum. This is usually detected during a newborn examination. In some cases, the testicle might be palpable in the inguinal canal, the passageway from the abdomen to the scrotum. Occasionally, an empty scrotum may be the only indication. Importantly, early detection is key for optimal management. How is cryptorchidism diagnosed? Diagnosis typically begins with a physical examination. A healthcare provider will carefully palpate the scrotum and inguinal region to locate the testicles. If the testicle is not palpable, imaging techniques like ultrasound or MRI may be used to locate the undescended testicle within the abdomen. Hormone tests can also be performed to assess testicular function. Laparoscopy, a minimally invasive surgical procedure, may be necessary in cases where the testicle cannot be located through imaging. While cryptorchidism doesn't have distinct types, in the same way some diseases do, it can be classified based on location. A testicle can be palpable undescended, meaning it can be felt in the groin, or non-palpable undescended, requiring imaging to locate. It's also classified as unilateral, one testicle affected, or bilateral, of both testicles affected. The location and palpability influence the treatment approach. Treatment and management aim to bring the testicle down into the scrotum. The primary treatment is orchiopexy, a surgical procedure to reposition the testicle and secure it in the scrotum. This is ideally performed between 6 and 12 months of age. In some cases, hormone therapy, specifically human chorionic gonadotropin (HCG), may be used to stimulate testicular descent, although its success rate is lower than surgery. Regular follow-up is crucial to monitor testicular function and detect any potential complications, such as testicular cancer. Currently, there are no definitive preventative measures for cryptorchidism due to its complex and multifactorial etiology. However, promoting a healthy pregnancy through prenatal care, avoiding exposure to environmental toxins, and ensuring adequate nutrition may reduce the risk. Research continues to explore potential preventative strategies, but at present, early detection and timely treatment remain the best approach. The prognosis for cryptorchidism is generally good with timely treatment. Orchiopexy significantly improves fertility potential and reduces the risk of testicular cancer. However, even with treatment, individuals with a history of cryptorchidism have a slightly increased risk of these complications compared to the general population, emphasizing the importance of ongoing monitoring. Recent research is focusing on understanding the genetic factors involved in cryptorchidism and developing less invasive surgical techniques. Studies are also exploring the impact of environmental endocrine disruptors on testicular development. These advancements hold promise for improved diagnosis and management of this condition in the future.